Let's talk about rotator cuff. What does rotator cuff tear or injury mean?
So the rotator cuff are those four muscles that start in the shoulder blade or the scapula. They come out, they attach to the top of the arm bone. And those four give you different strength in different positions. And that when the muscles become a tendon, the tendon attaches to the bone, sometimes you can get tears where the tendon attaches to the bone. You can get partial tears where it partially tears off the bone, or you can get full tears where it's completely torn off the bone.
Can you tell if it's by the physical exam if it's a complete tear, partial tear, or are you going to require x-rays? And involved in that, there's a muscle above the shoulder, the supraspinatus. Tell me about that and the tendon. And
that's the most commonly torn of the four rotator cuff is the supraspinatus, and you can tell if it's a partial tear or a full tear somewhat based upon physical exam. But x-rays are important to see if there's other problems, and an MRI is what we usually go to make the definitive diagnosis of a rotator cuff tear.
So can you pretty well tell with an MRI if there's a tear of the tendon or if the muscle has little multiple tears, I guess?
Absolutely. The MRIs are very accurate for rotator cuff problems, about 90 to 95% accurate. So MRI is a wonderful tool that we have to be able to determine if you have a tear, where you have a tear, how bad of a tear, and what does the muscle look like, because sometimes the tear is so bad that the muscle's atrophied. Well, then we're talking different treatment options.